Food Safety Systems Overview. First up in Food Safety Systems Overview is the FDA Food Code. It's important to realize that the FDA Food Code are guidelines. They are not law. They are intended for retail and food service establishments and really establish a baseline of sanitation and good practices. In terms of mandated, GMPs are mandated in the U.S. for everybody. And that's part of Title 21, Chapter 1, and there are a number of subchapters. The key one is Subchapter B, Food for Human Consumption. And parts 100 through 190 are the key ones, with part 117 being Good Manufacturing Practice. And in there are subparts A, B, C, D, E, F, and G. And in there are a number of subparts of part 117. Food Safety Systems Overview. First up in the Food Safety Systems Overview is the FDA Food Code. It's the baseline. It's the bottom of the pyramid. The FDA Food Code are guidelines. They are not law. They are intended primarily for retail and food service establishments. They establish minimum sanitary requirements and good handling practices that all retail and food service establishments and the manufacturers should follow. Now in the US, we have GMPs mandated for everyone. GMPs is an acronym for Good Manufacturing Practices. That is part of Title 21 of the Food, Drugs, Cosmetic Act. Chapter 1 has subchapters A through L. In those subchapters, Subchapter B, called Food for Human Consumption, is the key one we're concerned about. And in there, parts 100 through 190, with the key part being part 117, entitled Good Manufacturing Practice, Hazard Analysis, and Risk-Based Preventive Controls for Human Food. There are subparts of that A, B, C, D, E, F, and G. And subpart B is the primary one that outlines the current good manufacturing practice. And inside there are 9 subparts as well. Well, the point here is to point out that all of these guidelines are law. They're encoded in the Code of Federal Regulations, and it's important that we understand them and how they relate to our day-to-day business. Part 117, Good Manufacturing Practice, Hazard Analysis, and Risk-Based Preventive Controls for Human Food, Subpart A has general provisions. 117.1, .3, and .4, which essentially are definitions and qualifications of individuals who manufacture, process, pack, or hold human food. 117.5 are exemptions. 117.7 is about applicability of this rule. 117.8 also talks about off-farm packing and holding of raw agricultural commodities. And lastly, 117.9 outlines the records required for the entire subpart. So subpart B is the big one, and that's current good manufacturing practice, usually abbreviated as CGMPs. And in there we have 117, and we have .10, .20, .35, 37, 40, 80, 93, and 95. Each of those categories outlining a particular key part of food manufacturing. We also have 117.110 for those manufacturing industries that have to deal with defect action levels. So the question comes up between the FDA and the USDA, and certainly your local, regional, county, state regulatory agencies, who regulates what? Take a look at this chart to get an idea. There are 9 different categories of food manufacturing that are deemed high risk due to history of illness and injury, and those have requirements for food safety practices and food safety systems. Those categories encompass approximately 90% of all of the foodborne illness and injuries reported to the FDA. HACCP, Hazard Analysis Critical Control Point. A brief overview of HACCP. It was started in 1959, 1960 for NASA. There was a big addition in 1972 for low-acid canned foods. 1995, fish and fisheries were added as required to have HACCP. 2001 was juice. And most recently, 2011, the Food Safety Modernization Act, Preventive Controls for Human Food. The Food Safety Modernization Act is arguably the biggest federal intervention in food safety in the U.S. in many, many, many years. It was signed into law on January 4, 2011, President Barack Obama. The key requirements target all facilities that are required to register with the FDA. So in essence, FSMA applies to you if you have to register with the FDA. Which parts of FSMA apply to you is dependent on a lot of things, including what you do and the size of your business. Now, on October 10 of 2003, FDA issued an interim final rule to implement amendments to the Federal Food, Drug, and Cosmetic Act, which made by the Public Health Security and Bioterrorism Preparedness and Response Act of 2002, colloquially known as the Bioterrorism Act. And that act required domestic and foreign facilities that manufacture, process, pack, or hold food for human or animal consumption in the U.S. to register with the FDA by December 12, 2003. Now, the Food Safety Modernization Act mandates that you must re-register your facility every 2 years. As part of the Food Safety Modernization Act, there are 7 foundational rules. Some, all, possibly none will apply to you, depending, as I said earlier, on the category of food manufacturing you're in and also the size of your business. There are 7 foundational rules, and they are preventive controls for human food, preventive controls for animal food, produce safety, foreign supplier verification, third-party certification, food defense, otherwise known as adulteration, and sanitary transport of food. Rule number 1, preventive controls for human food, is really the foundation of the Food Safety Modernization Act. And this rule sets requirements for a written that is, emphasize written, food safety plan that includes a hazard analysis and preventive controls for those hazards that the analysis identified, management of those hazards that were identified in the analysis, which essentially means monitoring those hazards. Number 4 is taking corrective actions when necessary. Number 5 is verifying that those controls you put in place for those identified hazards are working. Each facility must have a qualified individual preparing, signing, and verifying that food safety plan. That individual must be trained and certified as a preventive controls qualified individual. I mentioned earlier that depending on the manufacturing category and the size of your business, certain requirements may or may not apply to you. Very small businesses are exempt from rule number 1. The definition is average less than $1 million in sales, plus the value of unsold inventory averaged over the previous 3 years. So preventive controls for human food is mandatory, but there are exemptions if you are a very small business. The last topic to discuss in these food safety systems is what's called the Global Food Safety Initiative, GFSI. This is not mandated, this is voluntary. It was started in 2007 when 7 major food retailers accepted the standard. It's more commonly referred to by the particular name of whichever GFSI approved individual scheme a facility is operating. So many places will say we have a BRC program, we have an FSSC program, we have SQF. It's generally required by distributors and retailers. Additional requirements may also be part of your supplier agreement. The saying for GFSI is once certified, accepted everywhere. The intention was to have an all-encompassing food safety system that all major retailers and distributors would accept, but it is voluntary.